Hi, Mike Saag here from UAB in the Division of Infectious Diseases. I want to talk today about COVID vaccination and our tendency right now to be lagging behind a little bit, especially in the state of Alabama in terms of uptake of the vaccine. One of the questions I get is, what happens if we don't catch up? What happens if we stay at about a 35 or 40% vaccination penetration in the population? What I'm concerned about, all my colleagues are concerned about, is that the 60% or so who are unvaccinated remain at risk. And with as much travel as we have, with the relaxation of almost all the things that prevent transmission in the last week, especially over Memorial Day, no more masks by most people, crowding together in bars and restaurants and churches, we're going to see transmission continue among the unvaccinated, especially, over the coming weeks to months. And that could mean maybe not a surge, but it's going to mean an increase in cases. And that will be starting to show up in cases coming to see us at the hospital, increased hospitalization, and I'm afraid a return to increase in deaths due to COVID. I'm not saying that to fearmonger. I'm not really about that. What I'm telling you is what I see and what my colleagues see, that this virus doesn't care whether you are in whatever situation. If you're not vaccinated, it will infect you if you give it the chance. And once you get the infection, then you're infected, and it will take its course from that point forward. One final point. If you're unvaccinated especially, and you start developing symptoms of COVID, get tested right away. There's some things that we can do in the form of treatment in the first couple days that are very important, that can shorten the duration of illness and reduce the severity. So monitor yourself for symptoms, but above all, get vaccinated. It's your sure way to prevent yourself from getting sick from COVID.